It's very important that providers, healthcare providers, and patients can have a conversation where they're both understanding the words, understanding the intention, and the expectations. And so if I use a term that a patient is not familiar with, I need to be aware of that. Hopefully patients feel comfortable asking for clarification, but sometimes they don't. And so it's really important to be able to recognize the words that we're using so that we can have a communication and conversation that we're all understanding. Well, one of the first things that I stress to patients when I'm introducing the visit is that this is a team-based environment. So I really try to introduce that level of comfort to begin with. And I invite them to interrupt if there's any questions or concerns as we talk. So it's just a discussion, just like anything else that they would have with their doctor or their nurse as they're sitting in an exam room. A compliance pack is really just a way to organize medications so that it's easier for the patient to take. If you think about the words we use there, compliance, it's not just about the patient taking the medication exactly as prescribed, but working with their healthcare team, so their providers and their pharmacists, if they're having problems taking medications appropriately. Again, coming back to that concept of team-based care, to make sure that patients know how to take their medications and can do so appropriately. So coming up with a plan in regards to how they're going to take medications, I think, is that concept of compliance. And the packaging part of it really is just a service that the pharmacy can provide, depending on the pharmacy that the patient uses, to organize their medications. So a patient only has to know, in most cases, the day of the week and the time of the day.
Is there a big cost difference here on whether the pharmacy does it or not?
Yes, it's much more convenient for patients to move forward with taking their medications appropriately. They don't have to do that legwork themselves or ask a family member to do so. The cost is really dependent on the different pharmacy. So some pharmacies will offer that as a service for free for the patients who do business with them. Sometimes there will be an additional charge with their copay. It's entirely dependent on the facility.
How much peace of mind does a compliance pack offer for a patient?
I've worked with specific patients before that have expressed significant relief multiple times. It's so much easier. I don't have to remember to refill my medications because the pharmacy is working with the provider to get the timing of the refills appropriate so that they can dispense that at the right time. They don't have to keep track of the different pill bottles. It's always helpful to know what you're taking and why, but in some patients that's too much to ask. And so you can have some peace of mind that, again, what is organized for you in the particular packaging is the appropriate medication for you to take at the appropriate time.